Greetings, everybody. My name is Ray Walker, your co-host. We're back again with another episode of Dear Denison. This time we have a very special guest joining us today to talk a little bit about the academic side of things, because a big part of the Denison experience is not only building relationships with friends and like other members of the Denison community, but also faculty members and getting a world-class education at Denison. So, without further ado, my advisor, Dr. Griffith. Dr. Griffith, can you introduce yourself?
Sure.
Say a little bit about who you are, and maybe some of your work as a professor and in academia at large.
Yes, absolutely. Thank you again, Ray, and to the admissions team for asking me to be a part of the podcast. I'm really excited. And Ray, as admitted students, you have an opportunity to come to Denison. You'll get to see all the great work that Ray is doing. So thank you again for having me today. My name is Dr. Griffith. This is my 12th year here at Denison. I'm associate professor of anthropology and sociology. I am a quantitatively trained sociologist. I received my undergrad degree from Payne College, a historically Black college in Augusta, Georgia, and my PhD from the University of Pennsylvania in Philadelphia, PA. I also have a master's in demography, so population studies, as well as Africana studies. And so, yeah, this is my 12th year. I'm currently the director of our new global health program. We are wrapping up our first year. It's been a great year in the midst of the pandemic. We've done some exciting things, and we're excited about the next year as well. I teach the intro class for global health. This semester, I also taught global health methods. So we talked about quantitative methods as well as qualitative methods. Students were able to collect their own data, do focus groups and surveys. Ray also took my race and ethnicity class, which is in anthropology and sociology. I also teach the survey research methods course in sociology. And I've taught intro as well before, as well as a demography of Africa course. My research primarily is focused on looking at, I have kind of two different strands of research that I've been focusing on over the last couple of years. One of them is looking at Somali immigrants, particularly women, and the way in which they access healthcare or the lack of healthcare. I'm actually excited to finish classes and to grade those papers that students are writing so that I can get back to some of the research that I started prior to the pandemic and kind of think about ways in which Somali women have navigated COVID-19. Another strand of my research is looking at women of color at predominantly white institutions and the way in which they strive and how they succeed. We have a great program, myself and Dr. Sears at Denison, called Sisters in Dialogue, where we meet monthly with students, women of color, and talk about different things that they are doing in the classroom, outside of the classroom, as well as giving different strategies as they navigate their college career. So as Ray knows, I'm kind of here, there, and everywhere all at the same time. But I'm excited to just share some of the great work that we've been doing in global health, as well as anthropology and sociology. But yeah, thank you again for having me, Ray.
So, as you all can see, Dr. G is very skilled and an expert in her field. But I did want to, you gave us a really good outline of kind of what I want to talk about in a few different directions. But first, I want to just talk about like, how did you find out about Denison as an
Okay.
institution? And then like what's kept you here. I think that's one of the biggest,
Yeah.
like especially for incoming students and like
Mhm.
it's just here in general. Like Denison is such a like bright place with so many bright
Mhm.
people, and like people get attracted to the place, and then people stay here for a reason. So
Mhm.
can you tell me a little bit about that for you?
I knew I wanted to teach at a small liberal arts college. I did my undergraduate degree at a historically Black college where liberal arts was really important. So while I was getting my PhD, usually you kind of on different tracks. You can either go the research route, go to the research one route in terms of teaching and as well as research, or go towards the liberal arts route. And so I knew very early on that I wanted to have just a relationship with students, impact with students in the classroom where my research, we would be able to talk about the research, but also get students excited about research at the undergraduate level. So one of the things that I can say about Denison is that each year is different. One year I'm advisor for the Denison Columbus Alliance group. Another year I'm leading a new global health program. I found that in my career that I'm attracted to doing a lot of different things at the same time. And so I've been able to come up with different plans, propose different things to the institution. And they've been received very well. One of them is the Global Health Program. And so it's just an exciting place to be where your ideas are actually become, actually something that you can see, and you can see the impact of them. And so I think that's what's kept me here, to be quite honest. I'm excited about what the students do post Denison. So I have really good relationships with alums. Some of them come back and talk to my class. We have an exciting time in the classroom as well as off the hill. I want to make sure that students are exposed to not only the things in the books, but also things that are either in their backyard or in their opportunity to kind of think through what it means to be either a sociologist, anthropologist, or even to be in the global health field. So it's been really excited to be at Denison in this moment where you have an idea and it's able to come to fruition, whether that be with students, whether it be with research, whether it be with a new program. So it's been a really exciting place to be.
Yeah, and when you talk about like posing these ideas to the institution, whether it's through like the Denison Columbus Alliance or your new global health program, I know you said it's been received well by like the university, but how do you think students interact with these ideas, and how do they engage with them?
Great question. I mean, to be honest with you, the global health program was something that we saw students really excited about. We had a number of students who were either creating their own major or making it a global health program without having all of the tools that we thought would be beneficial for a BA in global health. But we saw that there was a need from the students actually for the global health program. And so that was really the driving force. We had the classes on the books, but we knew we need to give them kind of a good number of core classes in order to kind of bring home some of the classes that they were taking either in anthropology and sociology, political science, down the hill and dance, athletics, health, exercise, sports science. And so one of the things that I think that is a really important as a student at Denison is that similar to I think what faculty do, you have ideas, you have things that you're interested in, you approach professors about those different ideas or your counterparts or your friends, and you come up with those things and you're able to plan through what that looks like. And there's actually funding and resources to actually bring those things to fruition as well. And so I think the faculty side as well as the student side has been a part. I've seen many different ideas come from both sides. And, to be here 12 years later and to be in a place where we're currently in a pandemic and these are things that we are studying in the classroom makes it really relevant and really important. And I think for students, they feel like they're not just reading about it, they're living through that moment as well.
Mm-hmm. I also want to touch on it's so important for students to build relationships with like faculty.
Absolutely.
Like the relationship me and you have,
Yeah.
I think it goes a long way, like post grad as well. But even when
Absolutely.
professors advocate for you to get a class or just things like that
Yes.
can go a long way.
Yeah.
Or advocate for you to like get an internship or get something like that. So like, can you talk about like
Absolutely.
that side of it? Like, how important is it for students to really be in that relationship?
I mean, at a small liberal arts college where there are 2,200 students, it's hard not to have a unique relationship with either a faculty or staff member at Denison. That's one of the things that I think, to be quite honest, it keeps me up at night, right? I was thinking about a student, it's like, oh my gosh, I forgot to tell that student this. So I'm sending an email in a way that I probably should be sleeping, but it's those really, I get to know my students really well. They get to know me, right? So the good, the bad, the ugly, all that in between, because it's really true. I mean, we are all really busy people. We have all different ways in which we kind of want to navigate, and students particularly want to navigate those 4 years. And so particularly even with the Denison Columbus Alliance, although there were 8 of you with different personalities, different things that you're going through, I had to make sure that I gave you what you needed at that moment. And even to this day, I have different relationships with all of you, right? And so that's been really exciting to see the mentoring really, it's not necessarily a formal thing as well. Like, even though with the Denison Columbus Alliance is usually for the first 2 years, I still see you, I still talk to you, your cohort members, and then my other group, the first Denison Columbus Alliance group that is actually graduating in a couple of weeks. And so again, just having that opportunity to not necessarily, yeah, sometimes to give advice, sometimes to be a role model, sometimes to be a listening ear, sometimes to be an advocate for students to let them know that this is what you need to do. This is how I can help you navigate that. Here are the questions that you need to ask. I think has been really great. And one of the things that I received when I was an undergrad, and so I feel like it's a way of paying it forward, right? I received that in undergrad. I would definitely not be where I am today without my mentor in undergrad who said, pull me aside actually in an intro to sociology class and said, had you thought about graduate school? And at that point, I had not, right? And so the conversation that we had that followed that, the late nights of working on a personal statement, the going over to his home. And at that time, my mentor his wife was the president of the college. And so having her look over my statement and having her advocate for me, I think I had really great role models of what that looked like. And so I find that doing this at Denison is a way to pay it forward. And I really enjoy it. I'm passionate about it. My students come to my home. My students know my family. I get to know their family, and we become like again. It doesn't just end at those 4 years, and so it's just been a really exciting place to be, and a really genuinely place to be. And even in the midst of the pandemic, where we had to shift classes, where some of the classes were remote, or half of the semester maybe had been remote, and then half of the semester was in person. I think those challenges were there, but I do think when we fast forward to the fall, things will be semi-normal in a way that I think the people who choose to work at Denison are excited about and hopeful about. But I do think mentoring is just a, a big part of my job, and is actually a part of my job that I really enjoy doing. You know, doing paperwork, not so much, but it has to get done. But
Right.
talking with my students, going for coffee, or having them over just to chit chat, even in the summer, it doesn't end either, from a 9 to 5. But it's a great place to be.
Right. And just to give the audience some context, the Dennis Columbus Alliance
Mhm.
Scholarship is a group, a scholarship out of Columbus, Columbus City school students that Denison provides a full tuition scholarship for. And Dr. G is one of the advisors that kind of oversees Denison Columbus Alliance. And there's different cohorts that have come through.
Mhm.
So that's just for context. Also, you mentioned something just about like networks and how like
Mhm.
you had a like relationship with I think what'd you say, the presidents? It was the
So
president.
it was my intro to sociology professor, who was a professor in the sociology department, that was also married to the president of the college.
Yeah. So just like small things like that can go a long way. Like
Mhm.
even here, you'll meet professors who have
Mhm.
connections with somebody you might want to be
Mhm.
connected with through a major or
Mhm.
kind of professional development activity or things like that. So I think that's also really important. The before we wrap up, because I know we're almost out of time.
Oh
Um,
wow, that went quick.
I know I do want to talk about like really the global health, a little bit
Absolutely.
more about that because I think that's like astronomical. Like
Mm,
the fact that you were able to bring that to Denison, because I feel like there was a void there in terms of the health field. Because I know
mm,
my roommate was
yeah.
always interested in the health field, and he felt like there was nothing really for him. But when global health came,
Mhm.
obviously funneling around biology and the sciences, but
Mhm.
global health became ever so more prevalent with the pandemic.
Mhm.
And I think students just, at least from what I've heard, have really
Mhm.
grappled with that and really strong to, oh, wow, global health is here. Like
Yeah.
this has never been here before. So what made you, like, I know you
Yeah.
talked a little bit about like how it's
Sure.
been going, but personally for you, what made you want to start that? Uh,
Mhm.
and how have students been involved in that work? And
Sure.
I know you talked a little bit about it, but
Sure, I can expand on that though. So the global health major, and particularly, I have been teaching a intro to global health that was in the anthropology sociology department, that was also cross-listed with international studies and Black studies. And every time I taught the course, there was a waiting list. Like students would just, I was doing the work. So as I stated before, the work with looking at Somali immigrants, particularly women, and the way in which they navigate healthcare in Columbus. And so I was just doing the work, and I thought, I wonder if we could offer the course. So I offered the course, and each time I offered it, it was full to capacity, as well as students on the wait list and students begging. This will become a part of your, if you come to Denison, that'll become a part of your Denison legacy, is that, you know, you can email a faculty member and ask if they would be willing to add you to the class. It's up to the professor to make that decision. But long story short, one of the things that with the class that I was really excited about is that it gave students the opportunity to look at health from an interdisciplinary perspective. So we not only talked about the social and cultural perspective of thinking about health, but then economics, right? If people don't have enough money to pay for healthcare, what does that look like? As we look at the COVID-19 vaccination and the distribution of those vaccines, we see that there is a very much a global divide, right? If we look at particular cases around the world and the number of people who are actually vaccinated. So we were having those conversations, having conversations about policy. So I have an exercise where I tell students that we take a health issue, they work as a team, and they do the research on a particular country as well as the issue, but then propose 4 to 5 policy recommendations and ways in which you would change that or implement, or what is going well and what was the things that you may want to add to that. And so giving students like real world hands-on experience and practical experience of thinking about a particular health issue has been really exciting to kind of get them to think beyond, again, just reading about, particularly read about Paul Farmer and axes of oppression, right? But to actually see the violence that you may not see on the bodies, but you see when you look at the different quantitative statistics of, you know, the number of ambulances in Haiti and what that looks like, and how long it takes, what are the wait times for going to emergency room in Haiti and what that looks like. For students to have those practical skills and to look at data and to analyze that has been really one of the ways I think I hope I get students excited about thinking about health, but not just leave it there, right? So once they know the problem, they have particular ways in which they can see the problem happening, but then provide particular ways in which to address the problems with these policy recommendations through a interdisciplinary perspective. It really got me thinking, well, we have a good number of courses. I was talking a lot to Dr. Weinberg, the president of the college, and he was also excited about an idea of a global health program. And we really just kind of sat down, myself, Dr. Henshaw in psychology, and Dr. Taku Suzuki in international studies, and thought about a way to propose the major. And so we did it January of 2020, before the pandemic.
I was just about to ask.
Before, yeah. But we were hearing, you know, little inklings of the pandemic, not necessarily pandemic, but COVID-19. We were talking about, a lot of people around the world were talking about it, but we never knew that it would
already
fast forward.
have this in the works.
Yes. So we had it in the works. And so we actually sat down in January of 2020, wrote a proposal, shared it with Adam Weinberg and Kim Copeland, the provost of the college. They gave us feedback, then shared it with the council. And then fast forward May 2020, during the pandemic, during a remote faculty meeting, I presented the proposal, I presented the program, and it passed through the faculty. So here we are, almost a year later, with 40 or so majors. We'll have our first graduating class. 4 juniors will graduate next year. And one of them is Ray's roommate, but they're also double majoring or majoring and minoring something else along with global health. And so it really speaks to the interdisciplinarity of the program, and what we hope that students will get out of it, and students are able to navigate, whether it be psychology, anthropology and sociology, dance. We have a cinema double major with global health. But the way in which we thought about this program is making sure that students get exposed to the multiple layers of health, not just the natural science. That's a part of it, but that's not the only part, right? And if you go in just only seeing the science part and not think about, you know, the cultural or the economic piece of it, then you're missing a piece of the pie.
Yeah. Dr. G, you're phenomenal. Thank you so much for this conversation. I just want to say, like, this conversation and like this dialogue, and just me and you being able to be here together, even though over Zoom, is just a product of what the liberal arts really means. and like how we can have these conversations and talk about a diverse new department in global health and the relationships that students have with faculty and beyond is, like I said, a testament to the liberal arts education and what Denison really brings to students, and also what students can bring to Denison. So thank you again, Dr. G, for your time.
Thank you for the opportunity.
Yes, this is Dear Denison, and we'll see you guys next time. Thank you.
Bye.